Together, we are investing $4.5 million to purchase new equipment and technology, which will expand our testing capacity here in this province to more than 16,000 tests per day by June. That's more than double our current capacity of 7,000. The new equipment will be integrated into our province's existing testing systems in Edmonton and Calgary, and will be located around the province at sites where it's most needed. And this is going to ease the strain on the Edmonton and Calgary labs while getting fast results for communities across Alberta. Testing is a critical element of our province's response to COVID-19, and it's essential to our province's relaunch strategy. Our decisions about reopening businesses and resuming activities require us to have the most accurate and detailed information possible. Testing gives us data that will inform our decisions as a province so that as restrictions are lifted at each of the three stages of our relaunch strategy, we can quickly evaluate the impact and adjust as needed.
As I've said before, aggressive, widespread testing is a cornerstone of our strategy to flatten the curve. This investment will further build Alberta's testing capacity, already one of the highest in the world. Once again, I encourage anyone who has symptoms to please arrange for testing, which will help us track and manage the spread of new cases. Today, we are reporting an additional 57 cases of COVID-19, bringing the total number of cases in Alberta to 5,893. Of these, 3,219 people have now recovered. Since my last update, we have also confirmed 2 additional deaths in the province. This brings the total number of lives lost to 106. Prior to the pandemic, 1 in 5 Albertans were expected to experience a mental health or addiction issue at some point in their lifetime. As a result of this pandemic, all Albertans may be feeling increased fear, anxiety, or sadness. Many Albertans, particularly those who experience illness, grief and loss, or financial hardships, may require additional mental health support. We are already starting to get information on the experiences of other parts of the world that dealt with the pandemic before us. Both Canadian and international surveys have found that about half of respondents reported having moderate to severe anxiety, and up to 20% reported depression. And we know that the impact on people's mental health will be felt for a long time. While it is clear that the COVID-19 pandemic may have a significantly larger and potentially longer-lasting negative psychosocial impact than the medical impact on Albertans, and while additional supports are in place and more are coming to support those affected, mental health is still an issue that many find difficult to talk about. This can make it challenging to find support. We often ask people who are struggling to reach out to their family and friends, but reaching out can sometimes feel like one of the hardest things to do. Instead, I challenge all of us today to try to connect proactively with our loved ones and ask how they are feeling, instead of waiting for them to reach out. Thank the people in your circle who uplift you and who improve your mental well-being, and ask how you can be that person for someone else. As I've noted, anxiety, depression, and other disorders are very likely to become more widespread as we continue to deal with the pandemic. We must talk openly and honestly about these issues and how they affect us. I am lucky to have a supportive family to lean on during what has been a challenging time for me, both personally and professionally. Long hours and increased stress can take a toll. If you don't feel like you have a strong support system to rely on, please know you have options for support. The Mental Health Helpline and the Addiction Helpline run by Alberta Health Services have increased capacity to take calls. I encourage you to call them if you need support. Their number is 1-877-303-2642, and you can find that number by Googling Mental Health Helpline Alberta Health Services. If you are in crisis or having thoughts of self-harm, please call 911. Other increased supports that have been put in place include increasing the capacity of the Community and Social Services 211 helpline and the Kids Help Phone. This pandemic and the measures we have had to take to contain it have affected us all. It is normal to feel anxious, scared, lonely, uncertain, or depressed. While we continue to work together to prevent the spread of COVID-19, we must also work together to support good mental health. A crucial part of this work is to be honest with each other about how we are doing, and having frank, supportive conversations about whether the phrase "I'm fine" really means fine, or if it means someone is struggling but not sure how to explain how they're feeling. It's okay if you're not fine. You are not alone. We need each other now more than ever.